I'm Scott Halpern. I'm a professor at the University of Pennsylvania and the director of its Palliative and Advanced Illness Research Center, or PAIR Center. And I'm really excited to announce the formation of a new center at Penn that will focus specifically on palliative care for patients with dementia and their family caregivers. This is a really exciting new initiative that's going to provide infrastructure and research support to really improve on the evidence base of how we care for some of our nation's most vulnerable patients.
I'm Kevin Volpe. I'm a professor at the School of Medicine and the Wharton School at the University of Pennsylvania. 10 years ago, we were one of two National Institute on Aging centers on behavioral economics and health. And since then, the field has grown considerably, with our efforts greatly contributing to that growth. Our new Roybal Center is going to focus on a variety of different approaches to reducing premature aging among Americans, including increasing physical activity, using technology to help facilitate the testing of ideas to improve health, and working on other areas like improving cardiovascular outcomes, better management of chronic disease, that we expect to have a big impact on improving the health of Americans around the country.
What our center will be doing is closely partnering with Genesis Healthcare, which is the nation's largest owner of nursing homes and other long-term services and support facilities in the United States. And a partnership of that scale has tremendous potential to provide a learning laboratory for us to figure out what really works.
There's lots of different areas in which important work remains to be done, whether it's reducing the risk of cardiovascular disease, increasing physical activity, reducing harm from opioids. Lots of important areas which our faculty, our staff, our trainees are all working on. We've made a lot of progress in the last 10 years, but there's a lot of progress that remains to be made. The U.S. does not rank very well in terms of life expectancy, and we'd like to make a significant contribution to improving that.
Among the many things that are exciting with the opportunity that the National Institute on Aging has awarded us are the fact that it's a really amazing recognition of both the breadth and the depth of behavioral science expertise at the University of Pennsylvania, as well as with our collaborating institutions that we've formed partnerships with over the year. It is one of those things that just makes coming to Penn to work every day a really enjoyable experience, to know that you're surrounded by such stimulating, provocative, and innovative colleagues. And it's really just a great testament and an honor, and of course a responsibility to shepherd these new resources in productive directions.